The National Dental Association is the premier organization for oral care, oral health providers. We are an organization that was founded in 1913, and we are advocating oral care for all. And we also have a family member of hygienists, dental assistants, students, as well as our spouses are involved with the NDA. We're unique in that way, and I think it's a privilege to be able to serve those that cannot serve themselves or cannot take care of themselves or cannot speak for themselves. We are the ones speaking for them about oral care and overall care, and that's what the National Dental Association stands for.
What are some of the biggest issues facing your association and the public in general?
I would say the biggest challenge is membership, and also I would say trying to get more African American students into dental schools and also keeping them there until graduation. That's a big challenge. So as we go from our practices into the community, we want to make sure that our students are also embracing the community and serving the community. Say, for example, when I retire, I would like to know that there's another African American that can come into my practice and take over and continue to serve the community as I did.
What type of a career is dentistry?
Dentistry is the best career that I know. I think we make differences in people's lives, and we can do it within an hour. We help with their self-esteem. We can motivate them to do things that they probably would not think to do, because now they have a choice, that they have a chance to smile. They have a chance to articulate what they want. A lot of people will come in and say, you know, I did not go looking for a job because my teeth were bad. Now they have teeth, so now they can go out and go seek for employment. So I think dentistry is the best profession there is. We make a difference in people's lives.
I am a pediatric dentist here in the New Orleans area, and we are here today at the Treme Center as part of the National Dental Association's convention. This is our community outreach that we will be servicing the children and adults in this area, giving them education on their oral and dental hygiene, as well as medical vision. This has gone on every city that the NDA goes to. They reach out to the community and have some type of impact on that community that they are in.
As a pediatric dentist, tell us why is this so important?
Oh, this is important because children and parents need to have education on their children's dental hygiene, that you should know, that's a tip, that your child's first dental visit should be the first birthday and every 6 months thereafter.
And why is that so important?
That's so important because we would like to prevent cavities, not just fix cavities. So if the quicker we can get that education out to parents and have them on board and become a team, we can help prevent all of those cavities and have healthy, happy children.
What's your reaction to everything that you've seen and heard here today?
Oh, I think this is going to be an absolutely fantastic program here today. I think that the National Dental Association has come into this community and that they will be a very positive impact on the Treme area and the greater New Orleans area itself.
I am in private practice in Cleveland, Ohio, and Cleveland has been hit pretty hard by the economy, and I also teach at Case Western Reserve, so I see a lot of children that are in need. And I think that part of the problem and one of the concerns that NDA has is not only access to care, but the understanding of the need for care. So that is the educational piece that NDA Health Now can contribute, not only to the children, but also to the parents, so that they understand the importance of oral health care as a part of general health care.
What's your reaction to the community effort out here today?
Oh, it's just beautiful. I mean, these kids, they're so excited. They are so beautiful, and I'm just so excited to see their reaction to what we have prepared for them today. So I hope that they will enjoy it and that they will take away some wisdom about oral health care.
The NDA has been involved in trying to help community efforts for a long, long time, and now they have initiated the Health Now program, and we're just really excited that we have kicked it off here in New Orleans, and we're excited.
What's your reaction to what you've seen and heard here today?
Fantastic. I mean, you look at the little kids and the smiles on their faces and realizing that you can really help them promote oral hygiene to make them caries-free in the future.
I've been in practice for 41 years. I've enjoyed being in practice. And as I look around here, I'm very excited in seeing all of the children that we have. Dental care for children is most important, and we've got to get more kids involved. And this is one of the things that the NDA is very interested in.
Why is that important?
Oh, it's important because of the total health of the patient. Patients' health starts in their mouths many times, and we can find things that are happening in there that affects the rest of the body. And so if we can get children to understand that, first of all, we want to take care of our mouths, and then that starts the taking care of the body.
I've actually been a dentist for the last 35 years. I graduated in 1979 from Harry Medical College. I've seen dentistry change a lot between technology and other kinds of things that have enhanced how we do dentistry and how effective dentistry is. It's amazing all the changes. However, there's still a whole group of people who seem to have been left out of some of those changes, and those are the people. They tend to be in the inner city, and some of the children, they just don't get the kind of care that they need to get.
Why is NDA involved in community outreach projects?
That is our mission. That is who we are, and that is to serve the underserved and to make sure that health equity is important, okay, and making sure that everyone has equal access to quality, affordable dental care.
Your reaction to what is transpiring here today?
Oh, this is great. I mean, to see the kids who are going to be exposed to dentistry and starting early in terms of their dental education and raising their dental IQ, which hopefully will last them a lifetime and help them to retain their teeth, well up into, old age.
I learned about helping my teeth.
What did you learn about your teeth?
I learned that your teeth is very important. Without them, you can't eat or you can't eat anything.
What are you going to do differently now?
Take care of my teeth.
Today I learned about cleaning my teeth and keeping my teeth healthy.
What are you going to do differently now than you did before?
Brush my teeth day and night and every day.
I learned today that you have to keep your teeth white or they'll go rotten and they'll fall out. And always keep your teeth good and shiny so people won't mess with you about your teeth.
What are you going to do differently now than before?
I brush my teeth 3 times a day.
Today I learned that you have to keep your teeth healthy. And you're supposed to keep it healthy while your teeth don't turn yellow.
What are you going to do differently now?
Brush my teeth day, morning, and night.
Today I learned that when your teeth not healthy, that means your body not healthy. I brush my teeth 3 times a day. I brush it morning, afternoon, and night.
Good morning and welcome to New Orleans and welcome to our first Health Now in New Orleans. I want to thank you all so much, all the volunteers that came out and helped, the committees that worked so hard to put this event on. We could not do it without you. We ask that you continue to do this however often that you can. I hope that you can make it an annual event if the NDA is here or not. I'd like to see this be a part of your community. And I'm sure that Dr. Madison will make sure that that happens, because this brings to the community an opportunity for all of you to come out and get yourself checked out, have your teeth checked, your eyes checked, your blood pressure checked, because the NDA is about oral care all over the body. We know that the oral cavity is the opening to the rest of the body. And if the mouth is healthy, the rest of the body will be healthy as well. If the mouth is unhealthy, the rest of the body will not be healthy. Everything that you eat goes through the mouth, so it affects the entire body. So we ask that you continue to remember all that you learned here at this camp today, so you can take the story back to your schools and back in your churches, in the community, and share your experience with about Health Now to your other friends that are not here. So we thank you all so much for all that you do for the National Dental Association.
I have been a dentist for 32 years, and I practice in Burlington, North Carolina. I've always had an interest in the mouth and the oral health, and it started when I was a very young child. It was something that I didn't really know a lot about, and there weren't a lot of role models back then. So I did a little research even back then and decided that this is something that I can do.
What's your reaction to what you're seeing here today?
This is wonderful. This is really wonderful, and this is a part of what NDA is all about. This is what I personally really get a lot of fulfillment from as a dentist.
I've been in dentistry for 36 years. I started practicing July the 10th of 1978. So I've just recently made 36 years, and I've treated this segment of the population from day one. So I see a number of these kids on a continuing basis, and I continue to do that today. And it's quite rewarding to help these kids reestablish, in some cases, good oral health, and in other cases just maintain good oral health. Because some of them come to me and need repair work, but by the same token, there's some come to me who are in good health, just need maintenance continually. And in the way of maintenance and prevention, we attempt to provide sealants for all the children, the various fluoride treatments, the varnishes and the gels, depending on the age category. I think Medicaid provide varnish for the kids from early on up to 6 years of age, and then beyond 6, the fluoride gels.
What's your reaction to this community outreach effort here today?
Oh, it's fantastic. It really is. It's the same kinds of kids that I see continually. It's just a larger number of them that I see in one place today. But it's really a beautiful setting, and it's the kind of setting that we do strive for.
I've been in practice for 26 years. I'm no longer in private practice. However, I was in private practice for a number of years, and it was a great experience, a great opportunity to provide not only oral health care, but education to my patients as they came in so that they could have better health.
How did the NDA National Outreach Program begin?
This program began as an initiative to further our mission, which is to ensure access to care. And through the NDA Health Now, more children will have access to care through the multi-purpose vans and the collaborations and partnerships in the communities, where we go into communities and reach out to vulnerable populations.
What's your reaction to what you've seen heard here today?
This is awesome, exciting. To see it launch in New Orleans is just great to see this vision realized. We have other cities and states we'll be launching in, but to see it come to fruition in Louisiana is just outstanding, so we're very excited about that today.
I've been practicing dentistry. Actually, I did 21 and a half years in the military as a pediatric dentist, and I'm now in private practice as a pediatric dentist for 9 years in San Antonio.
What are some of the issues that you see in your practice as it relates to young children?
As it relates to young children, one of the things that we're doing in the state of Texas for First Dental Home, we're bringing the children in at an early age, and that is at 6 months to 3 years. There's a program that specifically to help the children, help the parents understand that if you catch them early, that you're going to be able to prevent dental decay, a disease that can be taken care of early on. So by bringing the children in that early, what are they going to do? They're going to cry, they're going to scream, they're going to open their mouth, and that's what we want to do, give them that first-hand inspection, so to speak, examination, letting the parents know this are the instructions how you can prevent decay from continuing on in their life. Early on is important. One of the most important things I know that with what we do with the National Dental Association as practitioners, I'm reminded of a scripture, Jude 1:22. It says, "And of some have compassion, making a difference." And that's what we do. We work in the neighborhoods in our most of the underserved, underutilized areas where the doctors don't want to go to. We go to those areas and we support the children, we support the community, and as well as we can see here, we do the outreach so that the community know that we are here for their needs.
What's your reaction to the outreach program you're seeing here today?
I think it's fantastic. We've got our supporting company here is Colgate, and they always have their mobile van out. We got a lot of students here. I think the outreach is so important because it also it connects us with the students that are volunteering, and perhaps one of these days one of those students may end up being a dentist. So I think it's important for the networking and the communication thereof so that we can, reach out to the students, reach out to some of the parents that are here supporting their students as well. So it's a win-win situation for everyone.
I've been practicing over 40 years as a dentist, and I'm a pediatric dentist.
And what do you see in your practice when it comes to children and their dental health?
I see children, and I see a big need as far as dentistry is concerned in the growing population now.
Why is it important that dental health begin at an early age for young people?
So that we can kind of head off a lot of the problems that the older people are experiencing now.
What's your reaction to these NDA outreach efforts?
I think it's an excellent idea, and it's a way we as volunteers can give back to the community.
What's your message to parents?
Parents, take your children to see the dentist. We can find little things before they become big things. And when that happens, children are very happy and don't have to go through the pain of dental problems.
Your reaction to the community outreach program here today?
Oh, this is wonderful. I really love seeing things like this. Hopefully we can get to a lot of children and teach them some things here today.
Tell us a little bit about some of the other issues. Medicaid, of course, is a big issue. Tell us about that.
Medicare is a big issue, and I would say the entire National Dental Association membership, we take care of a lot of Medicaid patients. We believe in serving our communities, and we're the ones doing it. A lot of other colleagues do not do this, and we do not get compensated very well for doing it. And I would like to see that change, because our cost of keeping our practices open is just the same as our other colleagues. So we are not getting compensated for the work we're doing, but we're doing it because we love what we're doing.
What changes would you like to see in Medicaid reimbursement for dentists?
Oh, I think it should be much higher. Now I think some of my colleagues get maybe 25 cents on the dollar, 10 cents on the dollar. That's ridiculous. That doesn't even cover your overhead expenses. I would like to see it at least at 80% of what we do, we get compensated for it at the 80% level.
What's your reaction to this community outreach program that is taking place here today?
I think it is wonderful. I think it's a way to reach out into the community and touch the lives of children, their parents, their grandparents, their aunts and uncles. Under one roof, they can get a lot done. They can get their visions checked, they can get their diabetes, their blood pressure, and of course their oral care checked. And I think it's one way to erase the fear that people may have from going to the dental office. So it's fun here, the kids are having a good time. So I think you can erase that fear, and then maybe the next time they go to the dentist, they would not be afraid to go.
I think it's wonderful to see the children getting a chance to learn about dental health at such a young age. They have very young children here, and the fact that the children are very well behaved speaks well not only for the employees at the center, but for the parents who have cared enough to bring their children to learn about dental health. I think it's wonderful.
What would you like people to keep in mind about the profession of dentistry and the mission of NDA?
That we're here to make a difference. We're here to take care of our communities. We're here to advocate for our students and our families. And we're here to make sure that we do not lose another child due to the lack of dental care like what happened in Maryland. We do not want that to happen again, at least not under our watch.
If people have questions like more information, what should they do?
They can call the National Dental Association's office. And also they can look at our web. We have a beautiful web page, so they can check us out there too.